Hi, my name is Caitlin Fink, and I'm the coordinator of the Livingston County Community Alliance. I would like to welcome you to the second installment of our Parents as Partners in Prevention videos, also known as P3. These videos are a collection for parents and other concerned adults to educate them on drug abuse, where to find help, and other important topics. So welcome to the second video. This will be about navigating the system and helping your child find treatment. Today we are presenting Dr. James Shepard, the clinical director from Livingston County Catholic Charities, and Shannon Keenel, a concerned parent. We hope you enjoy.
I know my child is using drugs and needs a treatment program. Where do I start?
Well, the first thing is you'd probably want to get an evaluation to see, kind of at what level or what dysfunction there may be for the use. If it's a little use, then probably outpatient. If there's a lot of use, there may need to be kind of a medical intervention, such as an inpatient treatment. So the best thing to do is to start with an evaluation. Most outpatient clinics can do that, but sometimes inpatient clinics can do that as well. CMH has a wonderful service too, that they can do an intake and make recommendations if you call and have them kind of evaluate the adolescent.
Okay, thank you. What are the educational credentials of the people who will treat my child?
In the state of Michigan, all therapists and counselors are required to have a license. In Michigan, there's 3 types of licenses. There's the Masters of Social Work, there's licensed professional counselors, and there's psychologists. All of them are licensed by the state, and so you'll want to look for someone who has a license. Also in Michigan, there's the substance abuse certification, and a lot of therapists who work with substance abuse have that certification as well to specifically work with adolescents who are doing drugs or using alcohol.
How will you evaluate my child when the program starts?
The first thing that happens when you enter treatment is you'll go through an assessment. Usually it's called a biopsychosocial assessment, where the adolescent, as well as the parent, is evaluated for, the whole gamut of issues that may be, contributing to the substance use. Whether it's peer pressure, whether it's, trauma in the past, whether it's, different issues that may arise, the biopsychosocial assessment will help in determining, what factors are contributing and what kind of things need to be addressed when they're going through treatment.
How will you tailor the program to meet the specific needs of my child?
Again, one of the things we do with the assessment is we find out what the different issues are that the adolescent's going through. We love to incorporate the family. This has become a very essential part, especially with adolescents. So you want to work with the family so that everybody's kind of on the same page. The issue with the adolescent is finding out where they're at so that we can deal with the different issues that kind of show up in the biopsychosocial assessment, because we want to tailor the treatment and the treatment levels to where the child's at, because if we don't, it can create problems down the road.
Will the treatment program change as my child improves, and how?
Again, as they progress, we may find other needs that may need to be dealt with. Sometimes with substance abuse, it affects the adolescent in a way that as they progress in treatment, we may find that there's some mental health issues that may need to be addressed as well. So we'll tailor the treatment to deal with those issues as well. Different issues in regards to support and how to use support. These are all parts of what we'll do and evaluate as the adolescent goes through treatment and as they deal with the different issues that are creating the problems.
How will I know my child's getting better?
The big thing with that is you'll see a dramatic change in how they interact. how they, deal with the family issues, how they problem solve. They'll gain skills even in treatment that'll help them in their problem solving and so forth. You'll also see them developing healthier support, utilizing that support as they move along as well. These are big signs that adolescence is getting better.
Is there research available to support the treatments you use, and can you tell me about them?
Okay. One of the things that has really changed over the last 10 years is the research in effective treatments. One of the greatest, research findings has been a program called Recovery-Oriented Systems of Care. This incorporates a large number of factors in someone's progress through recovery. It incorporates the treatment aspect, where the therapist is dealing with different issues that the adolescent may be dealing with. But it also incorporates, recovery support, family support. And, these are all necessary in helping, develop a recovery plan that's going to last. Recovery-oriented systems of care have had a lot of great success, and that research has really, kind of bumped that success up. And so that's one of the large, programs that a lot of agencies have moved towards in using that support. Other programs such as cognitive behavioral therapy is one of them, dialectical behavior therapy is another program. These are different programs that have had a lot of success in the past as well. And so when you're coming to a program, you can ask what types of programs are they using. It'll give you an idea of the success or the different ways the adolescent's going to be dealt with.
What will the treatment cost, and do you accept payments from my insurance company?
Most insurances will pay for substance abuse treatment. Sometimes that may be limited, but most insurances will pay for that kind of services. If insurance isn't there, then there's also lots of different programs that can also fund treatment as well. The one thing you have to watch out for with insurances is that they'll have co-pays, they'll have different deductibles, and it's good to check with your third-party payer, the insurance, to find out what those may be. Even so, some of the agencies, some of the programs out there, can give assistance as well in that kind of situation.
What will happen if my child needs to be in treatment for more than the allotted number of days that the insurance provider will cover?
Okay. This happens a lot, especially if inpatient. Inpatient, sometimes the insurance programs have what they call medical necessity. And therefore, then, if the medical necessity is met, then usually they're, looking for discharge. That may or may not be true emotionally if the adolescent is ready to finish or not. And so sometimes there's programs that can help, subsidize continued stays, or in, outpatient treatment as well. There's opportunities that private pay opportunities, different kinds of grant funding to help continue treatment, emotionally if necessary. Again, insurances go a lot by medical necessity, and sometimes, other services will help if there's emotional issues that need more addressing.
Who can I contact if my child is uninsured or my provider doesn't cover these services?
Okay. The best place to start is calling an agency, an outpatient agency, if they're looking for an agency. They can a lot of times be a gatekeeper, give recommendations of different grants in different communities. Here in Livingston County, community mental health is kind of the gatekeeper for a lot of the uninsured who need substance abuse treatment. And so calling an agency, they can direct them to, getting some funding that way. Other kinds of, such as inpatient treatment. calling the site, you may find that they have scholarships or they have different, funding assistance that can help as well. The best place to start there would be to contact folks who've been dealing with that kind of thing, and they can kind of direct you to places where you can get help.
What kind of aftercare do you provide, and how long will that last?
Aftercare is kind of a misnomer. The real truth is recovery is a lifelong activity. It's something that you work on and you do for the rest of your life. So in one sense, aftercare is something that, as someone progresses through treatment, they teach them the different skills, the different activities, the different things that can help them continue that, process in what's called aftercare. But a lot of times inpatients will, when they leave an inpatient site, develop a plan for someone to continue that process in treatment and in recovery, so that when they get to their community, they continue to develop the kinds of support that help them as they move forward, as they maintain their sobriety. Recovery is difficult. It is tough. And so the more supports that are involved in an adolescent's life as they move forward, the greater the success. And therefore, this is a process that needs to be followed through, and these skills then get developed that can be used the rest of their life.
How do you support groups like AA and fit them into your treatment mode?
AA is a wonderful resource, but it's not the only resource. Again, AA represents support. They represent people who have had success in their recovery. They have utilized that program to sustain their recovery. AA represents a pattern of support that is a wonderful tool, and there's AA everywhere. For folks that can be utilized. But there's other resources as well. Things like Celebrate Recovery is a powerful resource. It's kind of an offshoot of AA. And for more religious folks, it becomes a wonderful tool as well as other kinds of 12-step programming that, also create that support. Churches, more and more churches are getting involved in creating support for recovering, alcoholic or addict. These programs are wonderful. They're necessary supports for someone who's moving forward in their recovery. One of the things that is so important, and I really try to get across to parents, is utilize Al-Anon. It's one of those 12-step programs that supports people in recovery, but it's especially there for parents, for friends, for family members, for people who are dealing with addiction in their household. And this is a powerful resource to support the family member as they deal with the alcoholic or addict, because they now get support, and these folks have been through it. So they can give hope, they can give advice, they can give support. Al-Anon is a powerful, powerful organization that helps with all the different aspects as the adolescent's going through treatment, helping the parent understand and learn how to support that recovery. That's what Al-Anon does.
Mm-hmm. Do you use medications in your therapies, and if so, how?
That's kind of a newer field. And if necessary, there are opportunities to utilize different medications in helping someone sustain recovery. Medication management is the term that they use, and there are lots of different different medications that can be used to help someone, especially if they're dealing with opiate addictions, if they're dealing with alcohol addictions. There's some wonderful medications that can help reduce cravings, that can prevent the use. Now, with medications, there's always risks, and you've got to keep that in mind. And working with a qualified physician with those medications can help reduce those risks and create an opportunity for success.
Thank you.
Thank you for watching this video. For more information, please visit our website at www.livingstoncountycommunityalliance.org or email livingston.community.alliance@gmail.com. Thank you.